name's Jim Clark. I'm a gynaecologist in Exeter in the UK, and I'm going to show you some simple laparoscopic suturing skills training. Our trainees are very keen to learn these skills. It's quite difficult at the time of an actual operation, and it's quite easy to learn many of them out of hours, in your operating theatre, or in your department. You don't need very expensive virtual reality trainers. This is a plastic box. It is a proper trainer, but we've used cardboard boxes in the past. This is one of our old laparoscopes we don't use anymore. It just works reasonably. I've got an arm here, but you can use anything to hold it, or use your friend. I've got a couple of old horns, and we've made some training aids. So this is just a block of wood with some screws in it, and you can use that to stretch a glove over and draw some markings on it, and that's quite a good way to learn to place your sutures nicely. You can do all sorts of other things. I've got some blocks here and some dice I've drilled holes in, and we numbered them and passed the suture backwards and forwards between them. That's quite good to learn from left to right coordination and suture passing. And all of these skills I will break down and show you in a nice easy way.
This course is divided into a series of chapters. Each chapter contains a single exercise of increasing difficulty. It's best to master each one before moving on to the next. The final exercise is a simulation of a vaginal vault repair and incorporates all the skills you have learnt through the course. Now you're going to need some equipment to complete these exercises. First, a laparoscopic training box. As you saw in the intro, we have a simple one, and we're using an old camera and a stand, but you could have an assistant and use your laparoscopic stack when theatres are over, perhaps when you're on call at night. There are, of course, training boxes, and this is a simple one that we have. It's not an advanced virtual reality trainer because they have their own exercises. This is just a simple box with a camera and a screen. To perform the exercises, you need some other equipment. First, we've used some dice or small blocks of wood that I've drilled holes through and stuck with some glue, and this is for passing sutures. That's a good exercise. And lastly, a block of wood with some screws in. We've stretched in this program a glove over it, drawn a scar and pinpoints to place sutures. You can also arrange the glove so that it's suitable for an exercise similar to closing an ovary with a running suture, and for closing vaginal vault. It's a little bit floppy, a glove, so you can use other things. In this case I've used some ducting tape, but you can use almost anything. Clearly you can make other exercises as well, and it's an opportunity to use your imagination. But these ones here are sufficient for the tasks in this video. This is the first exercise. It's a simple suture pass. It looks easy, but it's important to master this before moving on to other things. Keep the instruments in view at all times. Try not to hurry this exercise, just do it as perfectly as you can. Place the ports high at the level of what would be the umbilicus, at the same level as the camera, and begin by passing the first instrument in through the right hand port with the suture material. Present it to the left instrument. Grasp the suture, run it between the jaws of the first instrument from right to left. Release, pick up again, and pass through the jaws. Keep both instruments in view at all time. You'll find this exercise very helpful when you come to suturing. Keep going until you've passed all suture to the left hand instrument. Stop, turn around, hand the loose end and take the suture material out and both the ports out under direct vision. Now the exercise completes in reverse. Bring the suture through the left hand port, hand it to the right, and pass between one instrument and the other in the same way, sliding the suture through the jaws of the left hand instrument. This way, you're able to keep the suture under tension and direct it. This will help you in later exercises. When you come to the end, pick up the suture, present it to the right hand instrument and take it out. Remove both instruments under direct vision and record the time. In this exercise, we're going to pass the suture through some angle blocks. Cut the suture to about 20 centimeters or a long trocar length. Introduce it, holding the suture about 3 to 4 centimeters from the end. Pass the suture through the angled blocks following the arrows. You can use a second instrument to help guide it. In this exercise, we're going to show you how using the light reflection on the needle will help orientation to the needle holder. Essentially, if your light source is in line with your needle holder, then the reflection will be on the center of the needle when you are at right angles to it. Take a little time to examine how the light reflection on the needle changes dependent on its position. The needle needs to be placed in the needle holder at right angles for a good suture technique. A combination of holding the needle at the tip with your left hand instrument and grasping the suture material about 1 centimetre from the needle with your right will allow you to orientate the needle in any position that you wish. Now practice this exercise in the trainer. So your receiving instrument, which doesn't have to be a needle holder, needs to grasp the needle right at the tip. Holding the suture with your right hand instrument, move it backwards and forwards and look at the reflection. When the reflection is in the centre of the needle, assuming that your light source is in line with the needle holder, then the needle will be orientated correctly at 90 degrees. Now you can do this in reverse. Use your left hand instrument to rotate the needle backwards, and again swivel backwards and forwards with the right-handed instrument, and now you have a back-handed throw. You can do the same again now to arrange for your needle holder to come in through the right-handed port. This is much easier for many elements of suturing. Again, use a reflection to orientate the needle ready for pickup with your right-handed instrument. And do the same again in reverse. Practice these moves regularly, and then you will be able to place the instrument and the suture in any way that you wish. In this exercise, I'm going to show you how to change a simple surgical knot into a slip knot. This allows the knot to be pushed down the line onto the tissue, then tightened and locked. Cut your suture to about a trochar's length, or 20 centimetres, for this exercise. Begin by placing a single stitch, as shown in this teaching aid we have in the box at present. Begin, as with the last exercise, in orientating the needle nicely. For intracorporeal suturing, we usually cut the stitch a bit shorter at about 20 centimetres, or more or less a trochar's length. Pull your stitch through, leaving just a short standing end. Now we create a D, as you can see, and set a single throw. Complete the knot and pull the standing end through. Leave it loose for the moment. Now do the same in reverse. Again, creating a D. It's not so easy with the needle holder in the central port. And and pull the standing end through. It does not have to be tight at this stage. The next step is called breaking the knot. So take the part of the suture just by the needle and the part that exited the material and tighten them. This straightens the suture and allows you to run the slip knot down onto the tissue. We'd usually use a knot pusher, but you can use the needle holder for this. Once it's been run down nicely to the tissue, it can be locked by tightening the free end. Finally, complete the knot by creating a D and making one last throw. In this exercise, we'll show you how to tie a standard intracorporeal knot. Like all surgical knots, this should start with a double throw. You will find it easier if your suture length is shorter at 20 centimeters. We'll demonstrate both with your needle holder in the suprapubic and right hand port. Begin this exercise by creating a nice stitch, orientating your needle as we've practiced before. Pull the stitch through and create a nice big D. This time, make a double throw. And complete the knot. Try and keep the standing end shorter, as this will help with the next throws. This time, tighten the stitch. Now we make the D again in the opposite direction. It is more difficult using the needle holder in the suprapubic position, so practice this repeatedly. It's much easier making the second throw if your needle holder comes from the right hand lateral port, but of course you may not always have a port in that position. Complete the knot. And once again, as in the first position, creating a large D to facilitate the throw. Keep practicing these knots many times until you feel confident in making the throws and tying it properly wherever your port positions are. In this exercise, I'm going to show you how to tie Weston's knot. This is a surgical slip knot that is very effective and useful for extracorporeal suturing. For this exercise, take a nice long length of suture and wrap it around something convenient to form a loop. Now tie a half hitch with the free end pointing downwards through the loop. Pinch it between your thumb and forefinger to hold it steady. Remember, the free end is pointing downwards through the loop. Now take an instrument like a clip and grasp the free end. You've brought the instrument upwards through the loop. Bring it back down and then pass it through the little gap next to your finger. Do you see that? It says come around and through the gap next to your finger. You could let it go now, grasp it and tighten it. This is Weston's knot, and it's a lovely slip knot, and that will tighten as you pull it down. You can give it a little lock. So we'll do this again now. Create your loop, tie the half hitch with the free end pointing down and through the loop. Hold it and secure it between your thumb and forefinger. The free end, as you can see, is pointing down. Use your instrument or clip, come up through the loop, grasp the free end, pull it down through the loop, and then back over and through the gap next to your finger. Do you see? Bring it over and through the gap. Pick up the free end, tighten the knot, and run it down, and give it a little lock. Now we're going to use Weston's knot inside the trainer. Place a single stitch nicely using the needle orientated as we have practiced. Here we're using a standard and full length of suture, and we need to bring it out through the same port that it is being placed in by. Tie Weston's knot and then run it down and lock it. If you use a knot pusher for Weston's knot, it does tend to tie very securely, but for the purpose of this exercise, and in fact in real life, we always lock it with at least one single intracorporeal throw. Do you see the technique of running the stitch through the needle holder, a bit like in exercise 1? In this exercise, I'll show you how to place a running suture. This is good for closing a larger defect, such as an ovary after a cystectomy. Use a shorter length at about 20 centimeters, and we'll be tying this intracorporeally. In this exercise, we've created an ovary, perhaps after a cystectomy. Orientate your needle in the normal way. In fact, it's easier if you bring all of the stitch into the trainer or the abdominal cavity. Begin by placing a stitch from outside to in. Set up your needle and place the next stitch at the opposite end of the ovary from inside to out. With this exercise, it's important to be mindful of the free end and stop it from running all the way through. Now we're going to lay a series of stitches from outside to in, then inside to out, closing the defect and burying the first stitch. You can tighten each one a little as you've placed it, but be careful not to lose the first free end. For the exercise, 3 running bites is sufficient. Be careful not to lock the stitch, as would have happened here, otherwise it will not run. Finally, end the repair with a stitch from inside to out. To complete the exercise, we now need to finish the repair with an intra-corporeal knot, first tied with a double throw and then 2 locking throws. As this tightens, the stitch will run and bunch up, affecting a good repair. Try to keep the knot square. If the sutures become deformed, creating the D makes it easier to tie. So now you come to the final exercise. This is the most complex and brings together all the elements of the exercises that you have done so far. It mimics closing the vaginal vault after a laparoscopic hysterectomy. What we want you to do is to close each angle with a box stitch or a mattress suture, i.e. that comes from back to front, front to back. That's then tied extra-corporeally with Weston's knot, slipped down and locked intra-corporeally once. Do this on each angle, cut the stitches. Finally, close the central part of the vault with a figure of 8 suture starting from front to back, i.e. you need to reverse the stitch. This will be closed intracorporeally with a double knot and locked twice. So this is our vaginal vault repair exercise. We'll begin by orientating the needle, but this exercise, and in real life, is much easier performed with the needle holder coming in through the right lateral port. The needle slightly angled, so it sits nicely at 90 degrees. Each angle requires a box stitch for this exercise, or mattress stitch. We're going to come from the back to the front, then just adjacent to that at about 1 centimetre, from the front to the back. This requires reversing the needle as we showed in one of the earlier exercises. Grasping the point and revolving it by holding the free end of the suture about 1 centimetre from the needle. The suture now goes from front to back and needs to be removed through the original port at which it was inserted. Bring the stitch out and tie a Weston's knot and run that down. Here we're going to tighten it with a knot pusher, but you could just as easily use your needle holder. Now we're going to lock this stitch with a single intra-corporeal tie. We'll complete this knot by cutting the stitch. This is then repeated to close the left-hand vault angle in exactly the same way. Reverse the needle for the second part of the box stitch. Spend time orientating the needle nicely at every opportunity. Overall, this saves time. It's worth being careful not to lock the stitch otherwise you'll find that it will not run. Note how helpful that first exercise was in running the suture material through the needle holder in order to give it tension before creating the knot. Cut the stitch and the left hand ankle is repaired. The last part of the exercise is an intra-corporeal throw, so you may want to slightly shorten your suture length to 20 centimeters. Reverse the needle because we're going to come from front to back. And make a figure of 8 suture. That means from front to back and front to back again. Complete this knot, cut any loose ends, and you have finished the final exercise. Now that you've completed all of the exercises, give yourself a timed test. Place a single extra-corporeal Weston knot with 2 single locking knots. Cut the ends with scissors. Make sure that you have performed all elements of this as perfectly as you can. If you've completed all of these exercises, well done. There's no doubt that you will have improved your skill. In our unit, we give our trainees charts and they will time each of the exercises. As practice continues, progress becomes very evident. At the end, we will assess them on the final exercise of vault closure. I hope you've enjoyed this course, and may I wish you very good luck.